Is your chronic cough a sign of COPD bronchitis? Imagine waking up every morning with a cough that just won't quit. If that sounds familiar, you might be wondering what's behind it. Chronic coughs are common, but they can also be a sign of something more serious like chronic obstructive pulmonary disease, especially the bronchitis type. A chronic cough lasts for at least 8 weeks and often produces mucus or phlegm. This is a key feature of COPD bronchitis, which involves inflammation and swelling of the airways. When these airways are inflamed, they produce more mucus than usual, leading to that persistent cough. This cough can be worse in the mornings or when you're physically active. People with COPD bronchitis often notice wheezing, chest tightness, and more mucus than normal. The cough is usually productive, meaning it brings up mucus that can be clear, white, yellow, or green. It's important to know that a chronic cough alone doesn't mean you have COPD. Other conditions like asthma or lung infections can cause similar symptoms. But if you have a history of smoking or exposure to lung irritants, a persistent cough should raise a red flag. Doctors will look at your medical history, do a physical exam, and perform lung function tests called spirometry. These tests measure how well your lungs are working and can confirm if airflow is blocked, which is a sign of COPD. Early detection is key because COPD symptoms tend to develop gradually and worsen over time. Managing the condition early can help you breathe easier, reduce symptoms, and slow down the disease's progress. Treatment options include quitting smoking, avoiding lung irritants, and using inhalers or medications prescribed by your doctor. Sometimes, your doctor may recommend pulmonary rehabilitation or other therapies to improve your quality of life. If your cough lasts 4 weeks and produces mucus, especially if you have risk factors like smoking, it's a good idea to see a healthcare professional. They can help determine the cause and start appropriate treatment. Remember, catching COPD early can make a big difference in how you feel and how well you can breathe in the future.